much, and good morning, everyone. It's great to be here and to share information about the UK approach, but also I'm really looking forward to hearing some of your perspectives as well on this important area of antibiotic consumption and data collection. So for this presentation, I'm going to give a 10-minute overview of the UK approach, and so this gives you an idea of the agriculture situation within the UK. So what I've done is I've looked at the weights of animals that are reared in the UK, and so this really highlights that the UK has a very big sheep sector. We have the biggest sheep sector in Europe, so that does contribute quite a lot to our overall animals in the UK. The antibiotic use is thought to be relatively low in the sheep sector. Then we have a big cattle sector, which includes dairy and beef. And we have quite a large poultry sector, which includes meat poultry as well as laying hens. And then as we go further down, so pigs represent 10% of the animal weight, but they are the highest antibiotic using sector. So it's interesting from your perspective, you're saying that poultry is the highest. Actually, in the UK, the poultry antibiotic use has gone down, is actually relatively low. And so you'll be in the UK, it's the pig sector, which is our highest using sector. And then we have some horses, and we also have a quite a large salmon sector, and particularly in Scotland. So the story around antibiotic use, monitoring and resistance. I mean, obviously antibiotics have been around for a long time, and you'll see a timeline in the next slide. But I would say it really started hitting the headlines. We're talking around kind of 2012, 2013, and that's when there started to be increasing concern about resistance developing to antibiotics, particularly in human medicine. And they were finding that there were, increasing resistant infections, and some of these bacteria becoming increasingly difficult to treat. And so, as you can see from some of these headlines, there was a real, concern about, for example, here that without effective antibiotic, surgery would become life-threatening, and, any kind of immunosuppressive treatments, cancer therapies, if you don't have the antibiotics, then they're much higher risk. So they become a lot of concern at this stage. And there was also concern about use of antibiotics in animals, and that and that some of this resistance in people could be driven by the use of antibiotics in animals. So on the right hand side, this is just highlighting that in 2015, AMR was added to the National Risk Register alongside a lot of the other major risks that you can see listed there. And so this really helped to increase the political focus on AMR. So this gives you a timeline on different actions within the UK. I'll go through it fairly quickly. So 1969 is obviously a long time ago, was the Swann Report, where the concerns about antibiotic resistance were being raised way back, well back then. However, we didn't start collecting antibiotic sales data until 1993, and we started reporting the antibiotic sales data in 1998. So this is just to highlight that we started with sales data well before we actually started publishing use data. And I think sales is a really good place to start with surveillance. Antibiotic sales data actually became a legal requirement in 2005. In 2006 was when antibiotics were banned for use as growth promoters in the UK and in the whole of the EU. And then it wasn't until 2013 that we started combining our sales and resistance together in the same report. And we also published a One Health 5-year AMR strategy. So that was our first strategy, which was 2013 to 2018. And this was a really important moment, because it's a One Health strategy, and it meant that at the time there was quite a lot of blame happening between the human and the animal health sectors. The human sectors were blaming the animal sectors were blaming the human sectors. But I think at this stage, the One Health was starting to be considered, in that everyone's got to consider their own area of responsibility and work together towards this joint issue. In 2016 was the government commissioned a report called the Independent Review on AMR, which was otherwise known as the O'Neill Review. And after that came out, we asked the sectors to develop targets, and you're going to hear a lot more about that later in this presentation. And that's been a really important moment, actually, because the targets have been really important in driving improvements. And then we started publishing antibiotic use data split by sector in 2017. And then in 2019, we published a 20-year vision because AMR is a long-term issue. It's not a short-term issue. So we had to have a long-term vision, which was to contain and control resistance. And then, as you can see, we've published further 5-year national action plans, so covering 2019 to 2024 and 2024 to 2029. So hopefully that's a useful timeline to show some of the government activities and the sector activities as well around antibiotics. So I'm going to show you later that we have managed to have some really significant reductions in antibiotic sales in the UK in food animals in particular. People often ask us how we've managed to achieve this, and there isn't any one answer because AMR is a complex issue, multifactorial issue, and also any kind of behavior change has to involve multiple different areas. So there's not just one thing you can do that will make a difference. I think one of the things that are fairly unique in the UK, so the first R of this model is rules and regulations. So while we do have rules and regulations and around antibiotics, a lot of the improvements that we've seen have actually been driven by the industry. So as a government, we've given the industry ownership to actually make a difference in this area. And so the industry bodies have been absolutely vital, and you'll hear more about this later, but they include the likes of the British Poultry Council and the National Pig Association, who started collecting data on antibiotic use. And they also started forming these antibiotic stewardship groups, which bring together vets and farmers and feed industry representatives, and basically the key stakeholders that are involved in improving antibiotic stewardship. And so they developed various initiatives around improving use. And really, the industry bodies are really trusted by the farmers. They're really important messengers in this area. So that's been very important. And in the UK, we also have farm assurance schemes, which are these are schemes that provide. One of them is Red Tractor. They provide standards on things like food safety, welfare, and environment. But they also provided standards on antibiotics, for example, requiring regular vet visits, requiring the formation of health plans, which are focused on preventing disease on the farm. And in the case of the pig sector, there are also requirements for submitting antibiotic data to their medicine hub, which you'll hear about later. And so farm assurance is an interesting area, and it's actually a requirement for most of the major retailers that farms are farm assured. So therefore, if they have to be farm assured in order to sell into these major retailers. So that's been a really important driver. The rest of them I'll go through fairly quickly. So education has been very important. It's important that vets and farmers have the right knowledge and the right skills. And we've invested in some online learning platform for vets called the Farm Vet Champions. There's also been some online training developed for farmers. And in Wales, they developed something called the Farm Vet Champions initiative, where they actually had a network of prescribing champions. And that's been really effective at bringing about some of these improvements. So the next one is social pressure. So as well as having the knowledge and skills, the farmers also need to, and the vets need to have the motivation to actually act. And I think publishing data has been a really important motivator, because once you start publishing use data and you start publishing targets, which we'll talk about later, then the best performing sectors were very much rewarded reputationally and emotionally, and then the sectors which weren't performing so well then had more pressure put on them to start collecting data and to start driving improvements. And really there was very much a momentum. So once one or two sectors started publishing antibiotic use data, then we found that a lot of the other sectors started publishing the data too. The E of this is economic. So this is an interesting one. We know that by reducing antibiotic use, obviously you'll spend less on medicines, but also if you really focus on preventing disease, then your animals will be more productive, they'll grow faster, they will produce more milk, they will have better reproduction. So really, there's a lot of benefits economic benefits to preventing disease on farms. But sometimes we know that you might have to have a short-term cost to actually prevent disease, but there should very much be a long-term benefit. And then there's been various tools developed, biosecurity tools, medicine recording tools, and there's a tool I've showed there on the bottom right, which is a SMART goals tool for vets, so that they can helping vets to set SMART goals around driving improvements. Communication is really important. I won't go into detail, but you can see here that we've had to work a lot on communicating the key messages, and this includes to vets. So you can see some posters there, which are aimed at vets. There are also some communications to farmers. So there's some examples of codes of practice that were produced and guidelines for farmers relating to antibiotics. And then in the case of small animal work, there's also communication to the pet owners. So you can see there's the trust your vet on antibiotics, and information on pet owners that antibiotics are not always needed, and that that the focus is on only using antibiotics when absolutely necessary. Yeah. Targets have been vital. With the sectors publishing targets, then they've been publicly accountable for actually delivering on those targets. And the first set of targets were published in 2017. And importantly, these targets, although there were targets around reducing antibiotic use, which is important, the idea of the targets were that they're very much focused on disease prevention. So they were looking into those areas that are highlighted on the right. So there were targets around improving vaccinations, targets around biosecurity, around improving husbandry, as well as responsible antibiotic use. So the whole idea is that you don't want to reduce antibiotics and then have lots of health problems. What we want is to reduce antibiotics in a responsible way and maintain and improve animal health and welfare. And as it says at the bottom, continuous dialogue between the farmer and vet is in the UK, certainly that's been a crucial part of this whole process. The reasons for the success. So firstly there was very much a government focus. As I mentioned before, we had the One Health National Action Plans. It was put on the National Risk Register. The government commissioned the formation of this review on antibiotics, the independent review. So the government very much highlighted the need to act. But then we gave collective ownership. We built relationships with the sectors and gave them collective ownership on the whole AMR issue and helped them maintain their reputation on the issue, as well as coordinating the antibiotic sales, use and resistance activities. And then the industries did the rest. They formed their own sector stewardship groups, which bring the stakeholders together to improve data, to improve antibiotic use. The industry led on the data collection activities and the benchmarking activities, and they set their own targets. And also the industry helped lead on the farmer and education and goal setting activities too. So it's really been very much a joint approach. And so thanks.